Namaskara. I'm Dr. Sunita Rana Agarwal from Dr. Agarwal Hospitals, Bangalore, and I'm an ophthalmologist as well as I do genetic medicine. Whenever there's blurry vision in only one eye, that means most common cause is the refractive error. That means you've developed some glasses and we need to just change it with giving you some glass power. However, there are more serious conditions to this as well. One of the most simplest things is sometimes I see a lot of people that they do not know that they have been using only one eye for all of their life. So we call the other eye as a lazy eye. Suddenly at one time they've just dissociated their eyes by cover-uncover test and they find out that, oh, I'm not able to see in this eye. When we come back and see the patient, most likely it will be a refractive error. After the age of 4, it becomes very difficult to treat that. However, we may be able to still do something about it. Some of the more serious conditions can also come from blurry vision in one eye. There can be bleeding inside the eye, there can be so many other causes of just one eye going blurry. Screen time, definitely. Why screen time? Because number one, it makes your eye very dry. Dryness in the eye itself can lead to many times blurry vision, sometimes in one eye, most often in both eyes. We can have more serious conditions as well, like age-related macular degeneration, retinal detachment, diabetic retinopathy, stroke. Any of these can lead to just one eye developing blurry vision. Dry eyes is a very common problem in all of our society today, and definitely it can produce blurry vision in one eye or in two eyes. What is the most common cause is our environmental pollution, warming, whatever you want to say, but most important is the artificial lighting that we live under, the computer and any video display terminal like your screen time. Here, one of the simplest rules to do is every time you're sitting on a machine, use a 20-20-20 rule. So every 20 minutes, look at something 20 feet away for 20 seconds. Very simple task. 20 minutes, 20 feet away for 20 seconds. This gives our eyes a little chance to reaccommodate itself. Dry eyes, we have a lot of ways to treat it. We need to treat dry eyes because from what I'm seeing today, more than 90% of my population is dry eyes. They are less than 10 millimeters of water coming on a filter paper which is guarded. This way, if we want to treat the dry eyes, we have some simple ways to do that. Wash your hands, put little ointment on our fingertips and massage your lash margins. Second, use of artificial tears, which is an OTC product. And third is genetic engineering, where we take one drop of blood DNA, give it as injections. Whenever there is an association with pain, inflammation, and if that vision blurring is sudden. Now, it can also be blurring vision because of cataract, glaucoma, stroke, and bleeding inside the eye or a retinal detachment. Then we need to reach an eye surgeon as soon as possible. However, if that's not the situation, then we can go to certain other errors like refractive errors, which is the most common. One more thing which we like to do is, in these cases, especially diabetes and hypertensive, we like to do a preventive case where we like to prevent bleeding into the eye by doing laser treatment. These are special lasers which simulate the sun. We like to keep it at a very low threshold, and shooting the laser produces a photochemical change on the retina, thereby reducing the chances of bleeding into the eye. The similar situation is with retinal detachment, because retinal detachment mostly occurs in myopic eyes. In myopia, the eyeball has stretched, but the retina has not. When the retina has not stretched, it's going to produce small holes. If we are able to again do laser treatment upon the retina and thereby seal those areas, this will produce a decrease in the chances of retinal detachment in myopic eyes as well. Some simple tests that we can do is, if you have a calendar at home and stand about 10 feet away from the calendar like I have one calendar right in front of me, and you see the top line, then you go to the smaller lines and the smaller lines, and whatever you're seeing today, keep on doing this test every day, that you're seeing the same lines, the smallest lines at the 10 feet distance. Second, close one eye, read that line again. Close the other eye, read that line again. When you want to do for near vision, go to the newspaper, take out the classified sections because that's the smallest print. Can you read it? If you can read it, no problem. Close one eye, close the other eye, recheck that. This is some of the simple tests that we have for vision. When you have a child and you want to check that child's vision, then you take a ball, like a tennis ball, and you check at what distance can that boy identify the ball. If he can identify at 20 feet, 60 feet, it depends upon where he can see the ball. Now you go smaller on the ball. So we go now to a tennis ball. At 20 feet, can you go tennis ball, golf ball, table tennis ball? Then we go smaller and smaller. At what size can you see that ball? When he can identify a piece of chana which is at 20 feet, you know that his vision is normal.